Introduction to Basic Human Anatomy. Anatomy is the science that deals with the structure of the body and its parts. It describes the form and organization of the body parts. Fields of anatomy. Gross anatomy. It represents the structures seen without a microscope. Microscopic anatomy, which represents the structures seen only by a microscope. Surface anatomy, which represents anatomical landmarks on the surface of the body through visualization, by using naked eyes, and palpation. Regional anatomy, the study of anatomy based on regions or divisions of the body, such as the head or abdomen, the relations between various structures, like muscles and nerves and arteries etc., in that region. Systemic anatomy, which represents structures of specific systems of the body, for example respiratory system. Comparative anatomy, the study of anatomical features of animals of different species. Applied anatomy, the practical application of anatomical knowledge to diagnosis and treatment. Radiologic anatomy, the study of deeper structures of the body using radiographic techniques. Developmental anatomy. It's the branch of anatomy that studies structural changes of an individual from fertilization to maturity. It also studies of growth and development of fetus in the uterus. There are two approaches to study anatomy. Systemic approach, which is the study of one system at a time. Regional approach, which is the study of all structures within a certain region. Standard anatomical position. The body standing up straight and facing forward. The arms are by the sides of the body with laterally directed thumb. Palms and feet are facing forward. The legs are straight. Some similar positions. Supine position. In this position the body is lying down with face directed upwards. Prone position. The body is lying down with face directed downwards and the back upwards. Lithotomy position. The body is lying supine with hips and knees fully flexed and strapped for support. Anatomical planes. Sagittal plane, which is a vertical plane which passes exactly in middle line of the body. It divides the body into equal right and left halves. It is named after the sagittal suture of the skull. Parasagittal plane, which is a vertical plane which passes one side of and parallel to the middle line of the body. It divides the body into unequal right and left parts. Transverse or horizontal plane, which is a transverse plane which divides the body into upper and lower parts. Coronal or frontal plane, which is a vertical plane that divides the body into anterior and posterior parts. Named after the coronal suture of the skull. Oblique plane, any plane other than the above described planes. Anatomical terms of relative positions. Superior or cranial, means above or closer to the head. Inferior or caudal, means below or towards the feet. Anterior or ventral, means towards the front of the body. Posterior or dorsal, means towards the back of the body. Medial, means near the middle line. Lateral, means away from the middle line. Note that in fingers and toes, the midline used is the middle finger or toe. Intermediate, means between a more medial and a more lateral structure. Ipsilateral, the same side, as the spleen and descending colon. Contralateral, refers to the opposite side, as the spleen and gallbladder. Anatomical terms for limbs. Proximal, means closer to the trunk of the body or to another specified point. For example, the elbow is proximal to the wrist. Distal, means farther from the trunk of the body or from another specified point. For example, fingers are distal to the wrist. Preaxial border means the outer border in the upper limb and the inner in the lower limb. Postaxial border means the inner border in upper limb and outer border in lower limb. Flexor surface means anterior surface of the upper limb and posterior surface of the lower limb. Extensor surface means posterior surface of upper limb and anterior surface of the lower limb. Anatomical terms for solid organs. Superficial or external means situated near the surface. Peripheral also means outward or near the surface. Deep or internal is used to describe parts that are more internal. Anatomical terms for hollow organs. Interior or inside refers to a position near to the cavity of the hollow organ. Exterior or outside refers to a position away from cavity of hollow organ. Invagination or inward protrusion. It is the enfolding of one part within another part to create a pocket. Exvagination or outer protrusion. It is the protrusion of some part from its normal position. Anatomical terms for describing muscles. Origin. It is the relatively fixed end of muscle during its natural movement. Insertion. It is the relatively mobile end of muscle during its natural movement. Belly. Fleshy fat contractile part of the muscle. Tendon. The fibrous non-contractile part of the muscle attaches it to the bone. Aponeurosis. Flat tendon arising from connective tissue around the muscle. Hilton's law states that a joint tends to be innervated by a branch of a motor nerve which also supplies a muscle extending and acting across the joint. Another branch of the nerve often supplies the overlying skin. Anatomical terms of movements. Flexion, decreasing the angle between two parts. Extension, increasing the angle between two parts. The two actions are seen in the movement in the joints between the ulna of the humerus. Abduction is the movement away from the midline. Adduction is the movement towards the midline. Medial rotation is a rotating movement towards the midline. Lateral rotation is a rotating movement away from the midline. Note that medial and lateral rotation refer to rotating the upper and lower limbs towards or away from the midline, around their long axis. Circumduction is a circular movement combination of flexion, abduction, extension, adduction and rotation. Elevation, a movement in a superior direction, like the shoulder shrug. Depression is a movement in an inferior direction. Pronation moves the palm of the hand so that it is facing posteriorly, like typing on a keyboard. Supination moves the palm of the hand so that it is facing anteriorly. You can see it when you are holding a bowl of soup. Note that pronation and supination are easily confused with medial and lateral rotation. But the difference that pronation and supination can occur only when the forearm is semi-flexed. Dorsiflexion, it's the extension at the ankle, so that the foot points more superiorly. Plantarflexion, it's the flexion at the ankle, so that the foot points more inferiorly. Note that dorsiflexion and plantarflexion describe the movement only at the ankle joint. Inversion occurs when the sole of the foot faces medially, or inwards. Eversion occurs when the sole of the foot faces laterally, or outwards. Protraction is the moving forwards. You should know that this term is used only shoulder and the jaw. Retraction is the moving backwards. Opposition occurs when you bring your thumb and little finger together. Reposition occurs when you place your thumb and the little finger away from each other. Note that opposition and reposition, hand and thumb movements unique to humans,